Sleep, it's such a simple topic. And yet, because it's the primary behavior that keeps the brain healthy, few topics could be more important. As a pediatrician, it's obvious that pediatric studies behavior, and behavior is a function of the brain and relationships. Few things could be more fascinating. Our goal today is to better understand how behavior and sleep affect brain health. Sleep is important because it is the only way for the brain to recover from the stressors of the day. So many of the toddlers that I see, they're tired and overwhelmed. Too many teenagers I see are tired and overwhelmed. And quite frankly, I think many of us parents are tired and overextended. We can empathize with our children, and I think all of us would benefit from more sleep and more downtime. By way of introduction, I'm a father, I'm a pediatrician, and I'm an engineer. As an engineer, I enjoy studying problems to gain new insights, develop new ways to treat old problems. And within the realm of brain health, there is certainly room for new insights. As a pediatrician, I have the privilege to provide care for 2,000 families. I try to capture your wonderful ideas. I am daily inspired by your devotion. And then I'm in a position to cross-pollinate your wisdom with so many others. And you have given me clues on how we can better care for the brain. Because my children decided to grow up, it has become abundantly clear that the healthy behaviors we teach in the toddler years provide the tools for our kids to survive and thrive amidst the stresses of the teen years and beyond. When we teach our kids how to not only keep their bodies healthy, but their brain and feelings healthy as well, then they are ready for their independence. Then, when we stand in the middle of New York City, in the middle of Grand Central Station, as I had to do, knowing that there are 56 trains to choose from, and only one of them will take my son to the correct college, I can trust his good decisions. Quick agenda, we'll spend a decent amount of time talking about why is sleep important. We'll talk about the science of sleep. The better we understand it, it guides our decisions. Sleep recommendations, how much and how to, and we'll finish up with the benefits of sleep. Sleep is like water. It seems so simple, and yet we need it to survive. Why do we need it? Because it helps the brain recover from the stress of today, and next, it prepares the brain to learn tomorrow. There's really only 3 ways to stress the brain: physical, emotional, and intellectual. Yeah, there are some rare stressors: concussion, prenatal exposure, low blood sugar. But in general, the big stresses are physical, sleep deprivation; emotional, the work required to be calm under pressure; and intellectual, intense, sustained focus. I bring up brain stress in the context of sleep because the 2 ideas, they go hand in hand, right? If you stress your brain too much, especially if one is already sleep deprived, at some point it's hard to sleep enough to recover. In this regard, I think good sleep habits are like flossing, right? It's easy to do. We just have to understand its importance and commit to a simple daily routine. I have to laugh at myself for talking then about healthy behavior because I'm the guy with 8 crowns and 2 root canals. The dentist told me to floss, but I was too busy to listen, right? He saw my future. I think this is the power of pediatrics. With 2,000 families, toddlers to teens, I've seen your future. I am your crystal ball into that future. Behaviors that keep our brain healthy, our child's brain healthy, both their cognitive and emotional health, are important for our children to reach their full potential. Quick personal story. 25 years ago, I lost a teenage patient of mine to heart failure. Medicine didn't have a solution for this single mother. And so in 2000, I started a company to invent and develop a cardiac implant for patients with heart failure. I worked at my startup company from 8 in the morning till 5 in the afternoon. And then twice a week, I'd drive across Lake Washington to the emergency room at Seattle Children's Hospital. And I'd work from about 6 at night till 3 o'clock in the morning. I always knew when it was time to go home because my brain didn't work well. I started to slur my words. I didn't need speech therapy. I needed a nap. I couldn't concentrate enough to do basic math, to calculate drug doses. I didn't need ADHD medications. I needed a nap. I could barely keep the car between the lanes. In fact, there was one time where I fell asleep while the cop wrote me a ticket for driving funny. Not one of my better moments. I didn't need physical therapy. I needed a nap. I went to bed at 4, I got up at 7, I drove the kids to school the next day. And for me, invariably, the next day, I always walked around in a fog, a brain fog. I think this brain fog is interesting because it's the same thing people complain of after a concussion. And science has recently learned that after physical trauma, the brain chemistry doesn't work normally, and swelling in the brain, it reduces blood flow and glucose. So if concussion is a physical injury to the brain, then is excess stimulation and sleep deprivation a form of a behavioral injury? Could we think of it like an overuse injury to the brain? What if I worked back-to-back 20 hours of sleep? What if I worked back-to-back 20 hours and only got 3 hours of sleep? What if I did that for a month, 6 months, a year, 10 years? At some point, it's almost invariable or inevitable that one would develop an overuse injury to the brain. Sometimes I wonder if some of the toddlers that I see, do they walk around in a brain fog? And would we know it if they did? I agreed to give this talk because most of the developmental delay that I see in toddlers and the mental health issues that I see in teenagers is because they are tired and they're overwhelmed. Language delay, ADHD, a weak immune system, anxiety, depression, all of them have been linked to inadequate sleep. To be clear, children can certainly benefit from speech therapy, and children can certainly benefit from ADHD medications. But even those therapies work better when accompanied by improved sleep. This is an example of intellectual stress. This is a growth chart, and this is a graph of height versus age. This child started watching videos at age 9 months, and you can see how the height fell off of its trajectory. When kids are young, we can physically see the impact of stress on their brain, which controls growth. Cognitive stress affects height. And when loving limits are set, as they were here at 18 months, the height recovered. This growth curve is an example of emotional stress. This is a plot of head size on the left and height on the right. Babies become aware at 4 months of age, and that's why and when they get scared at bedtime. So when kids are scared and have not yet achieved independent sleep, they drop off their normal growth trajectory. And then once they're taught the emotional skill of how to calm themselves, they recover. So to summarize, we help our children when we help them find the proper balance between productive learning and restorative sleep. I once had a teenage patient of mine tell me, everyone tells us to work hard, but no one tells us how hard is hard enough. She barely slept 5 or 6 hours at night. I think there's too many of us that fall into the bottom half of this chart, tired and overwhelmed. So the answer is moderation, work hard, play hard, but moderation, it's so vague, right? How do I know when I find it? Book Two of the Fairy Queen is an important, but it is a difficult read. Our goal for our children and ourselves is to find that balance, right? Healthy learning with exploration and reading, and then calming routines to buffer the stresses of the day. Let's shift gears and talk about the science of sleep. A colleague of mine from Purdue is also an engineer. And in fact, he's the head of the Jet Propulsion Lab at NASA. He is a rocket scientist. And he has a great quote. He said, "David, all things properly understood are simple." I don't know. I studied thermodynamics and engineering. I barely passed physics because of it. And yet, the brain may be a little bit like thermodynamics. It may seem overwhelming at first, but once we understand its fundamental principles, then we can understand how to take better care of our brain. So, for example, there's only two kinds of neurons in our brain, positive and negative. Positive makes us move, negative makes us calm and focused. So as the day proceeds, we use up all the calming chemistry called inhibitory neurotransmitters, and all that's left is the excitatory chemistry. So when a toddler is bouncing off the walls, they need a nap. When a teenager has a hard time focusing, they need a nap. Many parents make an understandable mistake. They try to get their child overtired to fall asleep. The opposite should be our goal. Right? The more tired the brain, the harder it is to fall asleep and stay asleep. The more tired the brain, the harder it is to fall asleep and stay asleep. Sleep is also for brain healing. It's during sleep that the brain builds up the structures called proteins that were worn down during the day, and it restores its supply of energy, ATP. A good analogy might be muscle health. After a marathon, our muscles need to rest to repair the stress and strain of 26 miles. The harder we push our brain, the more it needs sleep to recover. People talk about sleep architecture. It sounds so sophisticated. But anyway, there are cycles of sleep, deep and light, and they help us organize our learning. REM sleep, rapid eye movement, REM sleep plays an important role in cognition, and REM sleep occurs more in the second half of the night. So disrupted sleep makes it more difficult for the brain to heal and solidify learning. So how much sleep do we need? Well, the answer is it's variable. It's variable depending on our age, and it's also variable depending on our individual gifts and talents. First, toddlers, they need tons of sleep because that is when 85% of the brain is developing. Right? 70% of the calories go to the brain in a toddler, 20% for adults. That's why a toddler can learn 3 languages in 3 years, and that's why it's easy to overwhelm their brain. My experience, gifted kids need more sleep. Right? Gifted kids need more sleep. I think the secret to help our baby reach their full potential is to prioritize loving limits during the day and great sleep at night. Strive for extra sleep, not that bare minimum, both for your child and for yourself. So to make the recommendations easier, maybe easier to remember, my goal or my recommendation is sleep 14 hours until the child is 4, 11 hours until 11, and 9 hours until 19. My additional observations or experiences that creative, analytical, caring people, they need more sleep. And introverts too, so astute, so perceptive, benefit from sleep. This makes me think of my dad. He died just last year from Alzheimer's. and he was one of the most caring people I knew. When you talked, he gave you undivided attention and focus. And as an engineer, he was also very analytical. So when he was awake, his brain was listening and caring incredibly hard. In the last couple of years before he died, he slurred his words. He was better in the morning, worse at the end of the day. Did he have a disease, or was he just tired? His writing became poor. Did he have a disease, or was he chronically tired? His concentration and memory left. Did he have a disease, or was he chronically sleep deprived and overstimulated? Amazingly, gratefully, even though he couldn't remember, he never stopped being kind, right? As my daughter said, kind is his default factory setting. A recently published study followed adults for 25 years, and it actually showed that sleep deprivation is linked to Alzheimer's. Maybe it's not a disease. Maybe it's a chronic overuse injury to the brain. Maybe other pediatric conditions that scientists call disorders are also overuse injuries to the brain. At a minimum, it seems like it's an idea worth considering. As we age, we can no longer look to our growth curve to find stressors. We as adults, we should heed the subtle symptoms: brain fog, articulation issues, headache, ringing in the ears, poor concentration, right? And X-ray and blood work isn't going to show it, but our brain is talking to us. Loving limits and more sleep are designed to reduce brain exhaustion and improve function at every age. So if sleep is important, then what is the secret to achieve good sleep habits? Well, it's like flossing. It's the daily commitment to a simple routine. I find that when we start with the emotional milestones, sleep is easier, right? When kids are scared, if we teach them how to self-soothe, they fall asleep easier, they fall asleep sooner, and they sleep longer. So the strategy is to provide a loving routine. The routine is going to start with a transition routine. Maybe you read them the exact same 2 books. And then you teach them how to self-soothe, which is any simple, repetitive behavior. Right? Babies suck their thumb, adults use slow breathing. My personal preference for our children, teach them to hum to the little stuffed animal. Interestingly, the woman who recently won the US Open tennis and the French Open tennis tournament before that, she hums the same song between points, and that's how she manages the suffocating pressure. At that elite level, where the technical skills are virtually identical, it's calm under pressure that differentiates the good from the great. Emotional work. Right? My personal experience is that it's the emotional work. It might be more rewarding, but it is more exhausting than intellectual or physical work, and yet so important. In my experience, again, of my 2,000 families and over the last 10 years, I've never met a toddler with developmental delay if they have 3 things: good self-soothe, good sleep duration, and loving limits to prevent them from being overwhelmed. As I said earlier, tired brains don't fall asleep or stay asleep as easy. And the younger the brain, the more astute the brain, the easier it is to overwhelm it. So this is why limits are important. And in this day and age, few things are as hyperstimulating and exhausting as technology, which goes at hyperhuman speed. Right? Animated videos for toddlers or rhymes, video games for teenagers. My personal recommendation for a toddler, no videos until at least age 3. Right? Let that 85% of the brain develop. We simply replace screen time with pretend play. Let them creatively generate their own story by talking to the little stuffed animals. And then after age 4, our kids, our teenagers, they still need us to moderate videos. During school year, maybe it's weekend only. and perhaps never more than every other day to prevent addiction. And then physically, we simply set healthy bedtimes to help achieve the sleep goals that I have already shared. So lastly, what are the benefits of healthy sleep? They're straightforward, right? For the brain, improved concentration, and school is more rewarding. For growth, optimize height, optimize brain growth. For our feelings, because emotional milestones mature into character traits, self-soothe as a toddler becomes composure. Loving limits becomes self-control. And lastly, for us parents, parenting is so much easier and so much more fun with these strategies. Thank you for joining us this afternoon.
Great. Thank you so much, Dr. Reuter. Got just a few questions here for you. So our first one is if you have any more tips that you could provide around starting to teach your child self-soothing.
It's a little bit of a tough question because it depends on the age of a child, right? If a child is under 18 months of age, then we just invoke the behavior, is what I said. Any sort of a transition routine, if you do the same routine for a couple of weeks, if the baby hears the exact same book every single bedtime, every single nighttime for several weeks, they're going to associate that book knowing that the next thing that happens is bedtime, right? And then with the baby, we might be holding them and cuddling them, but you're helping them maybe suck on their fingers and you're humming the exact same song, because what you want for your baby or toddler is for them to be able to suck on their fingers and be like, and they hum themselves to bed. We teach them for 5 minutes. And then the hardest part of sleep training is that they have to practice, which means you put them into their crib, they're gonna cry. We listen to them cry for 5 minutes, and then you go back in and you remind them how they can suck on their fingers and hum that song. And if it didn't work, chances are they were too tired, as I've said. So you simply pull the bedtime forward so that they have the strength, the emotional strength to do it on their own. If your child is older, anybody over the age of two to three, 1.5 to 3 is a really hard time to sleep train. But once your child is old enough to understand you, 18 months and higher, then we have to start explaining the reason behind our loving limits, right? My job as your parent is to keep you healthy. Healthy feelings is just as important as a healthy body. I know that you're scared. We all get scared. Let me teach you how to hold your lovey, rub on your lovey, and hum a song so that you can learn how to calm yourself. And again, we do it with them for a few minutes. We tell them that they have to practice on their own. And it's just an endless loop to do that. It's kind of like exercising. The older the child, it might not work in the first few times that you do it. But again, as I've said, the daily commitment to the simple routine, it always works.
Great, thank you. Another question we have here is if you have any suggestions for when your kid does get overtired, if you have any suggestions on how to handle that, or do you just kind of wait till the next day?
I mean, so many of the behavior challenges happen when our kids are overwhelmed. So, if the question is, do we ever have a discussion with our child on why they shouldn't do what they're doing when they're exhausted? The answer is no, that's not a good time to talk to them. You talk to them the next day. If ever a child is overtired, I kind of I fall back on all those calming routines and traditions that we create throughout the entire day. Again, the same books, the same songs, the same prayers, the same routine, everything that was comforting earlier in the day. When your child is overwhelmed and they can't calm themselves, they need those calming routines to help slow down their brain, right? Maybe the same book turns the brain off, the same song calms the feelings, and we just kind of help them get to a better position.